Hi there, it's me again. How you doing? Serious one this. Something I found. It was from June, but I haven't seen it mentioned anywhere else. I'm always late to things, so perhaps it has, but this is from Malawi, and goodness knows Malawi has suffered. Well, Malawi Jehovah's Witnesses suffered enough, didn't they, historically? But here's another one. God save us from religion. Have a look at this. So while the world commemorated the International Nurses Day on May 12, 2017, 4-year-old Dyson Mangisa curled up in a hospital bed at Malawi District Hospital, praying for God to save him from the religion of a pediatric nurse who failed to render to him assistance that was readily available due to her religious beliefs. Grace Mahata, not real name, is a Jehovah's Witness nurse, and on this particular day she had problems deciding whether administering a blood transfusion to Dyson would not put her in bad terms with her church and her God. Jehovah's Witnesses do not accept blood transfusion of any kind, as their church teaches that God did not aim for blood to be transfused from one person's body to another. Mahata, who until this day had been in the nursing profession for 3 years, took a long time debating with her conscience whether doing it would disrepute her religious standing at the expense of the 4-year-old child's life. So she'd already been, bear in mind, she'll have gone through training. She'd been doing the job 3 years, and now she decides to think about what she's going to do in this position. That should have been decided already. She had not expected that she would be the only duty nurse at Malawi District Hospital's paediatric ward on this day when Dyson got admitted due to malaria and anemia, and the clinician who attended to him prescribed to him a 450 milliliter pint of blood, which he was meant to receive upon arrival at the ward. According to Dyson's mother, Selina Mangisa, it took over 3 hours before her son received the blood until the time that the nurse found a workmate to conduct the transfusion on her behalf, as she had finally settled that it was against God's will. 3 hours! After the clinician prescribed a transfusion for my son, the duty nurse kept procrastinating. I did not know what the problem was until later, when she finally found a friend who was working in the male ward to connect the blood pint to my son's arm. It puzzled me a lot that I had to follow the other nurse to ask her why the pediatric nurse could not help us in time, and I found it hard to believe when she told me that the pediatric nurse could not do it because it was against her religion, explained Mangisa, who vowed to beat the nurse if anything went wrong with her son. They obviously have a very direct way of doing things in Malawi, but you can understand, can't you? Among Jehovah's Witnesses, blood transfusion is despicable. However, the question whether Jehovah's Witnesses medical personnel can be excused from facilitating blood transfusion has never been clearly addressed in the public domain. Information from the Watchtower Bible and Tract Society of Pennsylvania says God clearly forbids blood transfusion, as he commanded us in both the Old and New Testaments to abstain from blood, on verses such as, for anyone who's new to this subject, there is much evidence that counteracts the Watchtower's stance on this. They read a part of their tract, Myth and Fact, posted on the website in the year 2016, or maybe it's an article. This is from the Watchtower, surgeons regularly perform such complex procedures as heart operations, orthopedic surgery, and organ transplants without the use of blood, and patients, including children who do not receive transfusions, usually fare as well as or better. Than those who do accept transfusions. I just got really angry. In any case, no one can say for certain that a patient will die because of refusing blood or will live because of accepting it. Myth and fact. We know what the myth is, mate. Murderers. The site goes on to add that God views blood as representing life, so the witnesses avoid taking blood, not only in obedience to God, but also out of respect for him as the only giver of life. Thank you so much for this life. I'll just throw it away. Asked whether nursing and the whole medical profession exempts individuals with such religious beliefs to hold up their values at the expense of patients' lives, nursing officer at Malanja District Hospital Gloria Chirombo said the profession does not necessarily accept or prohibit expression of religious beliefs during practice. However, one thing that it clearly does is ordering the person in practice to aim at saving lives regardless of other human life extensions. Now, here's an interesting bit. When we take the nurse's pledge of service, we say we will not permit consideration of religion, nationality, race, or social standing to intervene between our duty and our patients. She says, from the internationally recognized nurse's pledge of service, which every nurse makes, the executive director of National Nurses and Midwives in Malawi, Dorothy Ngoma, believes that nurses and/or clinical officers who would rather put their religious beliefs in front of saving lives are definitely in the wrong profession. Said Ngoma, when one joins the profession, they already know what is likely to be involved, what is expected of them, so it's not right for a nurse or midwife, or indeed any medical personnel, to refuse conducting or facilitating blood transfusion, because where a blood transfusion is being ordered, it means a life is about to be lost. She added that medical people who deny facilitating blood transfusion should probably switch professions and go somewhere else where they can practice without contradicting their religious beliefs. And it goes on about another a poor lass whose family are with a church where they can't take any medicines at all, so she's laying there suffering. And the last paragraph says it against this background that Vanessa and Dyson, that's the one who was enjoying them, Jehovah's Witness nurse, who have experienced the worst negative effects of having religious rights, only pray that someday God will save them and the rest of children suffering in silence from religion. Wow, that's very powerful, isn't it? Very powerful. Last paragraph. There you have it.